ಹೇಳ್ತಾ ಇಲ್ವಾ? Yes. Initially, what we can look for this for pilonidal sinuses, they may be presented like this, an abscess, or they may come up with the follow-up. They can come up with the burst open the abscess like this, or burst opened and recurrent, and with the hypergranulation tissue, they may come. Sir, now it is slides are moving. Prasan sir. Hello.
It's moving.
Yes sir, yes sir. So before going for this, we should understand what is sinus and fistulae. As we all know, fistula, it is an abnormal communication in the perianal region. So there is a communication between the perianal region and the internal viscera. Either it may be anal canal or the lower rectum, which is having the connection. Whereas sinus, it is a chronic or acute abscess or a chronic situation of the sinus. It is a non-healing, which is a discharging, which is a blind tract lined with the unhealthy granulation tissue, which may be epithelialized. It is usually has a single opening on the skin and may connect to an underlying cavity of the foci or with an infection, most commonly seen at the end of the spine, postnatal area or interdigital area, what we can call at the end of the spine, where the buttocks start at that area groove. In that we must commonly see in this condition. Before knowing to this, one has to understand the anatomical aspect. It is a chronic inflammatory condition affecting the natal cleft, what we call it is the intergluteal cleft, typically involving the sacrococcygeal region. It consists of a sinus tract, often containing hairs or the debris and the granulation tissue, which may lead into a chronic infection or abscess formation with the presentations. And it is found in the midline of the sacrococcygeal near and or above the gluteal cleft. It is commonly seen. Typically lies between the coccyx and the sacrum, which extends into the subcutaneous tissues. It plays an important role. This second point is what is told in the context of Rona, Ashtasthana they have highlighted, Tvak Mausa Siras Nayu Sandhyasti Samani. If the pus is left as it is without managing, definitely it enters into the deeper tissues. That's what we can understand with this line. In recurrent cases, the sinus may develop secondary tracts extending laterally or deeper. This is also an important thing. Upeksham, Vidradim Upeksha. If you do improper treatment, if you neglect, definitely it will go to the deeper tissues like Tvak, Mamsa, Siras, Nayu, Sandhyasti, Samani, other things like Ashtasthana, what is highlighted in the Varuna concept. The same thing will happen. The structural components of the pilonidal sinus like skin and external features. Primary opening appears as a pit or a dimple in the midline postnatal at the end of the spine. We commonly, patient comes with, sir, something is, opening is there. Occasionally there is a smell. Occasionally there is a discharge like that. Sometimes represent the hair follicle openings or infected sebaceous glands may appear in that one. May have a purulent or a bloody discharge may be there. Patient will come with this history. The sinus tract, which runs vertically beneath the skin at the midline, lined with unhealthy granulation tissue, or sometimes it may open on either side as a secondary tracts may happen. The hair penetrates and triggering the foreign body reaction here, becoming a fibrotic leading to the chronic inflammation. How the hair enters? Because of the rolling movement at the particular area, because of the obesity and the excessive movement, the rolling movement at that particular area, because of the buttocks, the hairs gets to tend into the hair follicle. Once it enters, there is a negative pressure creates. One by one, the tuft of hair is formed. Future, it lead into the abscess. Once it burst opens, it is called as a pilonidal sinus. So this becomes later fibrotic and leading to the chronic inflammation condition. Or it may lead into the next stage, that is a secondary sinus openings. Chronic infections created lateral tracts away from the midline, often drain pus and serosanguinous fluid is drained here. Next is the subcutaneous tissue involvement will also be there. The inflamed and infected fat and the connective tissue may also in the deeper end tissues involved in the chronic conditions with the necrotic debris will also be present in that cases. The scarred and thickened tissue hinders the healing. So only it is known for its recurrence or it is known for its non-healing. These were the blood supply for this one and the lymphatic drainage in this particular area. Is the nerve supply which we can come across its importance. The pathophysiology of the sinus. Sir, the formation of a pilonidal sinus involves a multifactorial process including mechanical forces, foreign body reaction, infection and abscess formation, or the sinus tract development. These were the things which we come across. Slide there is a change in the slide pattern. So pilonidal sinus, it is a blind tract extending from skin to the deeper tissues lined by a granulation tissue or a epithelium. The broken off hair tend to collect in the natal cleft, which eventually penetrates the skin and forms the pilonidal sinus. As I discussed previously, because of the rolling movement of the hair in that particular area, there is a penetration into the hair follicle. Once the hair enters, the next hair will enter like that with the negative pressure. The tuft of hairs is formed. Hence, the Hodgis in the year 1880, who described the term pilonidal sinus. Pila is a hair, nidus is a nest of hair, sinus is a blind opening, which we have discussed initially. So Hodgis in the 1880, who described elaborately about this one. It is a tunnel or a sinus in skin. It may be filled with the pus, which may causing the formation of the cyst like this, what is shown here in this one. The cyst is formed containing the hair, debris and other things. So the synonyms for this is, it is also called as a jeep bottoms or a driver's bottom. Initially, if you look back in those days, nowadays were good roads and the very soft and smooth vehicles with the power steering. Earlier, I don't think those facilities were not there. Only the jeep were used to drive even in the toughest roads, which is an uneven roads also. Because of that, they develop, because of the rolling movement and the friction, the drivers used to develop, most commonly jeep were the vehicles which were the media for the transportation next to the animals like horse and elephants. So hence the name, the jeep bottoms or jeep driver's disease or driver's bottom. So the same thing explanation what is highlighted in our classics, the detailed description, the acharyas have given the two separate chapters like in 17th and 10th chapter separately for this one. Nidana Sana Nadivrana 10th chapter and the Chikitsa and other things in 17. And even 44th chapter in the Madhav Nidana, who also contributed for the importance to highlight and to understand this one they have given. Since 15,000 BC, it is explained about the importance of Nadivrana in the classics. Different procedures like Kshara Sutra, Chakrapani Datta, who highlight Kshara Sutra is one of the first reference which is highlighted in context of management of Nadivrana. Or else the Varti can be placed in the Nadi, or the Lepa can be applied when it is unripened to get the ripening and drain it out. For that purpose, Lepa were practiced. Once it opens, the Varti was an important thing. Where Varti cannot having role, then the Kshara Sutra was there. Of late, the important another procedure, the Kshara Karma, which is commonly and widely practiced nowadays in case of Nadivrana is Kshara Karma. So it is a type of Dushtarana, what is highlighted by Acharyas, which manifests due to the untimely mismanagement of Rana Shofa. Since Rana involves the deeper tissues, So it forms an nadi. Nadiva yadvahati tena matatu nadi. That's what, which drains, which creates a passage, flute-like. So it is called as a nadi. So Sruta highlighted in the Nidana 10th chapter. It is an analogous to the tubular structure, hollow in shape, like as we have explained in the understand in the case of fistula, whereas two communicating tract openings are there, whereas in Nadivrana only one opening is there, hence it is blind tract, considered as a blind tract. So Acharya has highlighted Shofam na pakvamiti pakvam upekshate va runam prachura puyam asadrutam abhyantaram pravishyati pravidaryam tasya sthanani purva vihitani tatah sa puyaha nadiva yadvahati tena matatu nadi. He says it is once you ignore, once you not drain completely, or if the pus is formed, if you ignore it, definitely it takes into the deeper tissues as is told in the context of Rona, Tvak Mamsa Siras Nayu Adis. It creates a tract, Nadiva Yadvahati Tena Matatu. The tract is formed and it is formed an abscess, later opens and it drains always like a pus, which is necrotic, which is a deeper tissue, forms the tough tissue will necrotize and discharging sinus will be there. That is Nadivrana, which you can able to see here in this particular diagram. So what are the common sites? The most important is what we get is interdigital area, postnatal area, or in the web space, especially in case of barbers, phalanges of the hands, both side or any one side they may develop. Or an umbilicus, which you can see in this diagram, umbilical sinus, which is a discharging with the hair. And second one with the two openings. These are the secondary sinuses. This is a primary sinus on either side, the anal canal or the postnatal. So the common thing is sacral region between the buttocks is most common. Next common is an umbilicus. Next axillary or an interdigital area, which is also a next common condition where we come across about this one. So these are the common sites which you can understand area where it is like a common dimple. You can appreciate the rolling movement of that particular hair in the buttock, which goes inside the hair follicle and forms a tough hairs, which you can see here. These are the hairs. See, these are the hairs which is kept here, taken from that particular area. So what is the incidence rate? 26 among 1 lakh population is very common. The typically late teeners, early 20s are very common. Gender male to female ratio is 4:1, as we all know the physiology of that one. The common in hirsute individuals, the hairy man is commonly affected with these diseases. The most important contents of the pilonidal sinus is or cyst is the hairs is the first dirty or a debris which is formed, which is like a retention cyst, like there is a huge collection will be there. You can appreciate there is a collection cyst and the hairs are there within the pilonidal sinus, which you can appreciate. The hairs which is taken from the sinus is, this is, you can appreciate this. So what is the pathophysiology of this disease is, the formation of the pilonidal sinus involves a multifactorial process, including the mechanical forces, repeated friction and the pressure in the natal cleft forces the hair go into the skin through the hair follicle. Once it enters, it becomes a foreign body reaction. The body treats the ingrown hair as a foreign substance and triggering and leading into the inflammatory response to that particular one. Then the infection and the abscess formation will be very common in that particular site. The secondary bacterial infection is the next common. Then leads to the formation of an abscess formation in that particularly postnatal area. It is called as a pilonidal abscess, initially present with the pilonidal abscess. Once it bursts open spontaneously or once it is drained, incision and drainage is done by a surgeon, then there is a sinus tract is developed. This may lead into the repeated burst open and heal, burst open and heal. This forms and chronic infection leads to the formation of the fibrous sinus tract lined with the granulation tissue, which fails to heal. That time the patient, because of the ignorance, they will not complain and they will not come to a doctor initially once the abscess formed, or once the abscess burst open, they will feel happy that I have cured from this disease. They neglect. So this leads into the fibrous sinus tract lined with the granulation tissue, which may lead into a chronicity that will not heal. Again, it may develop as a secondary branches, like a secondary sinus tracts may develop. At that time, sometimes due to journey or something, huge collection and swelling and inflammatory features are recurred, the patient rush to a doctor and then they will undergo the procedure. So this is what the flow chart, what highlights about the hair penetrates into the skin, which causes the dermatitis, then infection, fistulae formation will be there. Once it bursts open, the sinus formation will be there. Or else, again the recurrence, hair gets stuck into the sinus by negative pressure. Again, it attracts the hairs, further irritation, and then it leads to the granulation tissue formation. Or there is an obstacle which is not burst open, it leads to the pus formation within the pilonidal abscess. The multiple discharging sinus may emerge, like what I have shown in the previous diagram. So this is the one important thing we can see. The multiple sinus openings is there. So this is what we can appreciate. The same thing, Samprapti, what is highlighted by our acharyas, Pakva Shopam Upeksha, that leads to the excessive puya. There is a deeper tissues which moves into the Tvak Mamsa Sirasnayus. Then the different Runasthanas are affected. The multiple tracts may develop. Or it may lead into the formation of the Nadivrana, repeated infection that leads to the fibrous granulation tissue which remain as a sinus tract, that is a pilonidal sinus. According to Acharya, they have classified 5, but Acharya Shushruta has given 3 more importance like Dvandvaja, so it becomes 8. Otherwise, the 5. Ashtanga Sangraha and Madhava Nidana both have given only 5, Vata, Pitta, Kapha and Sannipataja and Agantuja. It is also called as Shellaja. And Acharya Sushruta also Agantuja or Shellaja. But he is added 3 more things like Dvandvaja, Vata Kapha, Pitta Kapha and Sannipataja. Like that, it has become 8. These were the individual features of Vata, Pitta, Kapha, Dvandvaja and Sannipataja and Shellaja. So he has highlighted with each its important clinical features and discharging and appearance. Accordingly, the management is highlighted. Being the complicated condition called as the Agantuja, Sannipataja, which definitely in Asadhya, what they say is Shelyaja, which can be Agantuja, is difficult to manage. As difficult to manage because it is not possible to manage only by Aushadhi or other things. So it has to be subjected for Shelya Karma. Either Shelya Karma or Anushelya Karma can be planned. So accordingly, we can plan it. How the patient presents with this, you can, when the patient comes to you initially, he says there is a pain and swelling in the sacrococcygeal region. Initially, they come with the pain and swelling. Sir, I am feeling something swelling, sometime pain. Or sometimes few patients come with there is a discharge, foul smelling discharge. Or sometimes there is a swelling, pain and fever. Or severe tenderness or a throbbing type of pain. When there is a full-blown abscess is formed, a pilonidal abscess, patient is complain of pain like a throbbing and which is persistent unless until you burst open or you drain, patient will not be happy. That becomes an emergency that moment. The acute abscess at the base of the spine is very commonly seen once you inspect by the history of patient. There is a discharge may be there, serosanguinous or a seropurulent discharge may be there. The tender swelling above the coccyx in the midline primary or sinus either sides of the midline or secondary sinuses may develop, which we have shown previously. The longitudinal direction with varies in length from 1 centimeter to 15 centimeter. This sinus strength may Either it is a cephalic or a caudalic, or it moves up or moves down. Usually moves up. Very commonly we come across. Sometime if it moves down, we may confuse with the fistulae in ano, perianal region opening, which is having connection to the anal canal. We may get confusion if it is a caudal direction of movement of the pilonidal sinus. The openings, primary, midline, secondary tracts extend laterally and may be bilateral. They may extend in a cephalic direction or occasionally caudal towards the anus. Often tuft of hairs may be noted projecting from the opening. You can see the tuft of hairs which is taken from directly with an artery, which is shown here in the umbilical region. These are taken from the sinus. There is a recurrent infection, the abscess formation, which burst open, forming the recurrent sinus with the pain, discharge, and discomfort. These were the clinical features based on the history, based on the clinical features and examination. Very important triangle is history, examination, and investigation. On that ground, you can go for the diagnosis. After that, there is a certain differential diagnosis has been also highlighted. Patient history suggests the problem. There is a swelling like this, there is a two swelling like this, or there is a multiple swelling, or there is an discoloration, or there is a scar, or there is a swelling like this. You can appreciate all these diagrams. Painful and fluctuant mass in the most common presentation of acute process of an abscess. In its earlier stage, only a cellulitis may be present, where a simple pain at the particular local area. In chronic stage, the diagnosis is confirmed by the sinus opening in the intergluteal or postnatal fold, approximately 5 centimeter above the anal region, which you can appreciate. Because around the perianum or a perineal region, very common opening is external fistulae opening are very common. We should not get confused with that. What were the differential diagnosis we can take? Furuncle in the skin at that particular area, local infection of the skin may be there, hair follicle. Or hidradenitis suppurativa, which is commonly seen the localized skin infection, very commonly in the inguinal or in the axillary region, very common. The fistula, as already known, it is a perianal connection with the two openings will be there. The same thing like abscess burst open and discharging. But perianal region, away from that region also there, we should not get confusion. The granulomatous or syphilitic or tubercular granulomas are also appear. You have to look back with the history, go for the examination of blood investigation or other investigation for the diagnosis. Osteomyelitis with the multiple draining sinuses in the skin. It is very commonly seen in the osteomyelitis also. Actinomycosis in the sacral region is very common. Once you exclude all these conditions with certain investigations like blood examination, X-ray examination of the chest, or X-ray examination of the LS spine, or a CT spine, or MRI, or sometimes USG. Based on these investigations like hematological or other radiological investigations, you can differentiate and you can come to a conclusion that it is a pilonidal sinus, because there is an abscess which has burst opened. It is at the postnatal area. It is having some hair or a tuft of hairs is there. The patient will give the history, and it is at the postnatal area above the anal region. So at the midline posteriorly, altogether it confirms the diagnosis of pilonidal sinus. So what may be the complications which we come across? The chronic pilonidal sinus may occasionally causes a sacral osteomyelitis, or necrotizing fasciitis is another common. Rarely a meningitis we have not come across. Can be morbid because of the high recurrence rate. See, this is one example I shared initially. This is operated previously by a surgeon, and there is a high recurrence rate, and he is under treatment. I think another month, I think this will be a complete healing. These are the previous operative scar. Now we are not doing any Kshar Sutra for this because it is an open wound like. We are doing only the Apamarga Kshara Varti we are placing. What is an importance of Varti placing here is keeping the Varti will clearance it does the Chedana, Bedana and Lekana of the debris. So for that reason, we are doing it. So these were the common complications we come across. The causes for recurrence rate is improper management of the postnatal pilonidal abscess, or a pilonidal sinus if you are not managing well. Overlooking of existing condition. If the already existing condition is there, if you are not treating primary cause, the secondary cause cannot be treated. The secondary existed diseases will not be possible to overcome that. So you should not do it. Entry of new tuft of hairs is very common. So you need to educate the people or the individual. The nature of work is to be shifted. The hygiene of the particular part is to be educated. So only you can overcome these problems. The breakage of scar, repeated injury to that particular area and rolling movement or driving or pedaling of the cycles and other things definitely irritates, and obesity is another cause for this one. So you need to educate. These were the causes for high recurrence rate. So avoiding these things, you can overcome the recurrences. What is Chikitsa told by Acharya? Nadinam gatimanvishya shastrona apatya karmavit. Sarvarana kramam kuryat chodanam ropanam. Chakrapani Datta, he highlights about use nadi, use this probe or a nadi, use for the application, and you can identify the tract, length and the direction is very important. I told in the beginning in the introduction, cephalic direction is very common, caudal is less. You need to check for the other secondary openings also. It has to be probed, then incised with the Shastra, then subjected for the Shodhana and Ropana of the Sthanika, or after that you go for the Ranavat Chikitsa. Or if the recurrent conditions are there, go for Abhyantara Shodhana, better refer a case to the respective departments like Panchakarma and other things, which they can subject the patient for Shodhana and other things, then you can manage with the medications. This is what cross-reference with an ethics we have to follow here. The non-operative treatment modalities like education, like regular shaving of particular part, trimming the hair, and natal cleft area to have meticulous hair control is very, very important in hirsute individuals, not for all. The proper perineal hygiene is also important, and certain medications like Triphala Gugulu, Lagusuta Sekara, Kamaduga Rasa, Kaishara Gugulu, Triphala Churna, Swadishta Virichana, Avipattikara Churna, Gandhakara Sayana, Gugulu Tiktaka Kashaya, Abhayarishta, Jatyadi Taila application, Panchavalkala wash. All these routine medicines are advised according to the condition. If the Pitta Vruddhi Lakshanas are there, give Avipattikara and Lagusutta like that. If Vibandha and other things are there, go for Abhayarishta or Swadishta or Avipattikara Churna. If for a Shodhana Ropana purpose, go for a Triphala Gugulu and Gandhakara Sayana. Like this, you can advise in the patient initially. The operative treatment important is in acute phase is go for the Vedana. That is drainage of an abscess is the first, because it is a foreign body. Unless until you let you out the pus, you will not achieve the healing. After that, use a judicious use of medicines can be planned here, either antibiotics or our Gandhakara Sayana Triphala Gugulu. We can use in the individual. If you are properly taking care of sterilization, you can use only the medicines instead of these antibiotics also. According to your this yukti, you can plan it. So operative, this is one important slide which you can see. Definitive treatment, what you can plan is the excision and primary closure done under general anesthesia or local anesthesia in a prone position. The important position here is jackknife position. Patient is asked to sleep prone and foot down like that. It is called as a exposed. The buttock area is to be exposed and you can easily operate. The prone with the buttocks elevated. All sinus tracts, unhealthy granulation tissue with the hairs are completely removed. Methylene blue is injected to demonstrate the multiple tracts so that it stains the tracts. And excision and skin grafting can be planned. Has got a high recurrence rate. Still, even if you do it, there is a recurrence rate is there. Excision with the Z plasty is a good results. The keratosis excision through the semilateral incision or a lateralized suturing with the wound way away from the midline, which gives a good result in this one. Excision with the closure using a Limburg, that is a rhomboidal buttock flap, is good result. whatever procedure, even if you do it, there is a recurrence chance is there. Even the Z-plasty, this is what the flow chart about, which highlights about the Z-plasty procedure, the patient position and the area sterilization, incision and other things. This is Z-plasty for pilonidal sinus. Initially, you can plan, mark the area after the anesthesia, then apply it, then you can repair. So this is another rhomboid Limburg flap for pilonidal sinus. Initially, there is an opening. You can mark it, then give the incision. After that, you excise that particular tissue, which is a sinus area. Completely, you have to take it out. Once it becomes free from that granulation tissue with the sinus, you can take this flap on either in this shape, and this is the sutures. So even in this case also, there are every chance of recurrence are there. So for that reason, the very basic, very daycare and a very economical, effective treatment which we can plan is, there is a, what is told in Agantuja or Shalyaja Nadivrana by our Acharyas, they said, this Shalya Prabhava, Shalya is Bala. Here is Bala is one of the important Shalya, you can go for management. Agantuja, if Shalya in the Twagadi Sthanas is not removed, leads to the formation of Nadivrana as it is highlighted in the quotation. Srava is Phenila, Matita, Swacha, Ushna and Rakta Mishrita, which is associated with Vedana if it is an Vidradi Avastha or abscess. It is Kritra Sadhya, what is told by Acharyas. It is Kritra Sadhya by Aushadhi and Sadhya by Shalya or Anushalya Chikitsa. Shalyaja Nadivrana Chikitsa highlighted by Acharyas is Vedana of Shalya Marga, Shalya Nirharana, that is Bala, Shodhana of Nadi Marga, Ranashodhana and Ranaropana using mixture of Tilakalka, Madhu and Grita, which does the Shodhana of that particular place. Taila preparation of Kashayas of Kumbhika, Karjun, Kapitta, Bilva, Vata, Udumbara, Laksha, Parisha and Kalka of Musta. Priyangu, Utpala, Sariva, Lodra, Dataki, Nagakeshara. This Kalka can be applied at the Shodhanartha and later can be achieved the Ropana in this Shalyaja. So, moving towards the important procedure, what is highlighted by Acharya is the Kshara Sutra Vidhi. What is an indication for this? Very important thing highlighted by Acharya is indications he has given. Krusha Durbala Virunam Nadi Marmasrita Chaya Kshara Sutrena Tachindya Tu Shastrena Na Tu Shastrena Buddhiman. Where an individual with the Krusha, Durbala, Biru, if the Nadi is at the particular place like Marma, during that time you may injure the vital tissues and it may lead into the Vaikalyakara or other complications. If you want to overcome all those things, better go for the procedure which does all the treatment modalities like Chedana, Vedana and Lekana, even Shodhana also sometime with the help of Kshara Sutra. So how to do it? The procedure highlighted by Sushruta, Eshanya Gatimanvishya Kshara Sutranusarinim Suchim Nidadyat Tatyante Tatenyamnashu Nihirat. What he says is, if you go to the Kshara Sutra, this is a Kshara Sutra which you have prepared, the Snuhi Kshara Apamarga and Haridra with the barber's thread number 20. Previously we discussed in our previous class. The same thing can be implemented here. I will show the procedure. Why it is important is, it is a simple, which is a safe, which is a less complications, provided if you are doing properly. If you are doing improper procedure, definitely it is also a complication. It creates complications. That's what in the context of Agni Karma, Acharya Sushruta says, Sadhyanam Samyak Dagdanam Apunarbhavam. Repeatedly, I am repeating this line because if the Sadhya Rogi, if we are doing properly the procedures, Apunarbhava is the one important thing. There is no complication or there is no recurrence. So if you are doing like this, definitely it is one of the important outpatient department procedure. You can do procedure and you can send the patient some same day. What happens here? The tough hairs come out easily during the thread changing because the railroad technique, what is highlighted in the fistulae, once you tie a thread at the lateral aspect of the knot and then you hold the artery at the medial aspect of the knot, in between the knot and the artery, you cut it and you pull it out. The knot which is present, old knot and the newer knot all together, which are moving into the tract, which brings the hairs, tough hairs which are present in the sinus tract. By this way, the foreign body is taken out and the new thread with the medicated thread is placed in the sinus, which has created the two openings, which maintains the patency of the tract as a mechanical thread is present. As a medicine which acts on the particular unhealthy tissue, which drains out completely the pus, which helps for the shodhana, and even gradually it goes for the ropana also. Because of this continuous drainage and debridement chemically, what is done by Char Sutra, the recurrence rate is very, very less, or you can say it is a nil. For the last 23 years, what I am seeing, I think more than 15,000 which are operated the cases. Among that, I think hardly one or two cases which has recurred because of improper follow-up, not because of improper management. Improper follow-up was the condition which has recurred, and they again facing the problem and they came. So this way, it is one of the golden thread, what you can say. The procedure of Char Sutra preoperative evaluation is must. Written and informed consent is taken. What you are doing, you have to take a signature of the patient. If a major, if a minor, take the parents or guardians. Part preparation at that particular part with the shaving initially, then injection tetanus toxoid 0.5 ml intradermally, and lignocaine sensitivity test dose 0.2 cc intradermally is to be given. That is intramuscularly TT, and this is intradermally. To see the adverse effect of the lignocaine, the local anesthesia is to be assessed. Then thoroughly explain the procedure, what you are doing, what duration is taking, how much the pain and other things. You have to prepare mentally the patient. Then they will accept and you can plan the procedure. These were the materials which we can plan for the instruments trolley. The position here is the jackknife position or the prone position. The anesthesia is a local anesthesia. Painting and draping, the cleaning of the debris, removal of the visible hairs and debris with the pus initially. By probing, the tract is found. The primary thread is inserted into the eye of the probe and passed through the tract. Probe is removed from the distal end of the tract and leaving behind the thread in the tract. After 3 days, Kshar Sutra is tied through railroad. After 3 to 7 days, which is missing 7 days, it is. Kshar Sutra is tied firmly outside the tract. Till the tract is completely excised, the Kshar Sutra is to be changed every week. And you need to assess the progress of the healing and what the condition is at that moment. So weekly we have to assess, and every 7 days or 8 days ask the patient to come. Because by 6th or 7th day, the thread previously used will loses its potential. So you need to use a new thread with a medicated thread. So it has to act within the tract. So this is one patient which has presented with like this an abscess, which under local anesthesia. This is a probing with a copper probe. The loading of the thread to the eye of the probe. This is the one thread is tied. The another opening was there with the another parallel opening, which is tied like this. You can see in the diagram. One is here, another one here. We may confuse with this. If you probe from here, it may go sometimes if you forcefully do it down like a fistula. So that should not be done. That's what in the Asian Karma, what is highlighted in the Susruta Sutra 25th chapter under the context of Ashtavidya Shastra Karma, importance of this, and even in Yogya Sutriya chapter, what is highlighted? Eshanya Gatimanvishya. He has highlighted it is practiced in Gunapata Kasta because it should not be forcefully done. As it moves, you have to do it. Otherwise, you may land up, you may create another opening. This may be a complications. So in this way, you can plan the procedure. So before that, you see this procedure. We'll give the demo of the procedure. You can see the patient with the pilonidal sinus. Painting is going on. Sir, now it is visible. Sir?
Yes, sir, visible.
Yeah. Repeat. There is a local anesthesia. You can see the sinus opening. Once you press, there is a collection is coming out. You have to infiltrate around the sinus. This probing is done from that opening. The sinus opening, it has to be what I said in the initially introduction. It is moving towards the cephalic, towards the head. And you can also check for the down caudal also. Sometimes it may be having direction, that direction also. So once you are taking up, that is a cephalic, and you can appreciate. So where the tip of the probe is coming under the skin, you need to give a nick because another opening is to be created. Through that, you have to pass the probe to this probe. Then you have to load the Kshar Sutra. After loading this one, you need to pass and keep into the tract. Then you need to tie a Kshar Sutra to that particular one. This is a method where you are under local anesthesia. It should not be tied too loose and it should not be tied too tight. If you tie too tight, the patient can't walk properly. Sorry for the interruption. I think some technical problem was there. Dr. Nitin, now it is visible.
Yes, yes, sir, visible, sir.
Yeah. Photo side important. Share video share.
Sir, now you can present.
Yeah, 1 minute, sir. 1 minute.
Because multiple presenter are there. That's why it is not allowing. Now I have allowed to present from multiple devices.
Yeah, sir. Yeah, sir. Yeah, sir. So in this way, we can plan the Kshar Sutra. It can be confirmed once again. You may ask question that why you put wealth very small one, you would have opened it. Definitely you would have opened the area where again the buried like. So once it is a buried, it will not allow the wound to heal. So for that reason, if you keep Kshar Sutra there, definitely it drains and it heals. Like the Chedana, Vedana, Lekana happens, simultaneously the Shodhana, Ropana will also be appreciated here. In this way, you can manage with the Kshara Sutra if it is a superficial one, if it is a smaller one. If it is a wider and deeper one, better go for and recurrent one. Better go for the another procedure, that is a Kshara Karma procedure. Prior to that, we'll go for few of the Paschat Karma. The importance is Sijbat also. Trifala Gugulu Gandhaka Rasayana, which we commonly prescribe. This is a mode of action. Kshara Sutra causes debridement of unhealthy tissue and excises the tract. The mechanical pressure facilitates the cutting of the tract, thus causing the complete excision. The effective wound healing and the pus drainage is there because it maintains the patency of the tract by presence of the thread. That is a Kshara Sutra. The chemical curettage by action of the medicines will be there with an incision and excision, both it does. And I can say there is no chance of infection or no chance of recurrence if you are managing properly. Otherwise, we come across with the minimal or the less chances in the procedure. So this is what I can say about the importance of this Kshara Sutra in the management of pilonidal sinus. This is Paschat Karma Sij Bath, or just wash with the Trifala Kwata or with the Panchavalkala Kwata or even with the betadine. Usually we give Panchavalkala and we give Trifala Gugulu and Gandhaka Rasayana. This is a common treatment, or sometimes Gugul Tikta Kashaya internally is to be given for the healing purpose also. Staniya for application, usually we give Jatyadi Taila application as a routine post-operative and follow-up procedure we are doing it. So after knowing this, we'll move on towards the Kshara Karma. This is a brief before OT what the patient presented with the chronic sinus at the postnatal or interdigital area, you can say this is an opening. So with the probing, we have passed, and with the probing, we have excised completely. See the procedure, excision with the cautery, bipolar cautery, completely excised, you can see here, which was deeper one. After that, we have used the Apamarga Kshara, Tikshna Pratisaraniya Kshara is applied. And you got that what you appreciate in the case of Arsha, the same Pakva Jambu Phala that indicates the Samyak Dagda of the Kshara Dagda Lakshanas. After that, you need to go for the neutralization with the Limbu Swarasa or any Kanji. We usually go for Limbu Swarasa. We wash it, then we cover. And this is the follow-up second day, you can appreciate. This is a follow-up second day. This is a follow-up 14th day, you can appreciate the wound. Then the follow-up 21 day, follow-up 28th day. At the end, you can see after 2 months, nothing is there here. This is what the importance of Kshara Karma. The same mode of action is a chemical cauterization, which contains Apamarga, which denatures the proteins and leading to the tissue destruction and removal of that particular unhealthy granulation tissue, which creates an inflammation, which reduces, and the healing promotion will be there with the same Kshara which we have applied, with takes out the slough, which promotes the healthy granulation tissue. Then you can appreciate the wound healing by minimal fibrosis will be there. The caustic action leads to the minimal scar formation, which can prevent a further prolapse. This is an prolapse of the recurrence of the disease. Some mistake is there in that one. There are certain Nadivrana, where you can plan Varti Prayoga. Why Varti and how will tell after the Kshara Karma procedure. Procedure which you have seen here already. This is just application. I think that video is not running. So there are certain Varti Prayoga like Aragvodadi Varti, Vantafaladi Varti, Vibhitaki Varti, Daturadi Churna Varti, Lavana Madhura Mishrita Varti. These were the different Vartis and the reference Chakradatta. You can go for this Gunavarti, Jatyadi Varti, Vidangadi Churna Varti, Sapta Gugulu. With this, I think we have completed the Nadivrana and its management through parasurgical procedures like Kshara Karma and Kshara Sutra, and knowledge about the diagnosis and the limitations about the other modalities, and how to overcome the recurrence and how to succeed in the management of this Nadivrana. And this is one of the burning issue like that of the fistulae. Even the plastic surgeons and surgeons facing difficulty and referring the cases because neither they give name or the fame because of the recurrence rate. So we are the fortunate to get such cases, and we have a weapon of Kshara Karma and Kshara Sutra with us. We have to salute to our ancestors for providing, and I am very happy by this practice. Thank you, Vasant sir, and all the participants. If you have any queries, any questions, is there?
Dear participants, why the
This is one important, sir. Just see the case which has recurred. I will show just a minute. One important case I told, it is under treatment. Post-operatively, he got again the discharge and the drainage was there, which we have probed, and we have kept thread, like as usual, the same procedures of the Kshara Sutra. After that, I have shown previously this diagram also. It has a cut and healing was there, and now also he is coming for the follow-up, which the case was brought from our intern, who is one of the relative of our intern doctor. So this is what the recurrent case, and the previously underwent surgery. Dr. Basava, the brothers, Basava brothers who brought this case to me. Thank you. Thank you, Aneda. Sir, thank you, Vasant sir, and all the
thank you very much.
respected participants.
Now the session is open for discussion, interactive discussion as well as queries, and any clarifications needed, you can directly unmute yourselves and ask the sir. Sir is very happy to answer you.
Dr. Nitin and Dr. Vasant sir.
Yes, sir.
Any
Yes, sir.
response from the audience?
Chat box, any messages are there? No messages.
No message in the chat box, sir.
Sir,
I think I am not able to reach. So
no, sir. Nothing like that. Sir,
yes, sir.
can you brief the Rakta Mokshana Yogya Avastha in Pilonidal Sinus as well as Agni Karma Yogya Avastha?
Yes, sir. Whenever there is a superficial, this one sinus tracts are there, sir. we are definitely going for the Agni Karma and we explore that like what we do in fistulotomy, the same thing, sinus tract opening with the help of cervical cautery or a cautery. Once you let open and keep it as an open wound, it can be, you can achieve the healing. Whenever there is an avastha like inflammatory conditions like before ripening like Nadivrana Vidradi, like if it is in the Ranashofa Avastha, Lakshanas are there in the patient, you can better go for Rakta Mokshana. This is one of the indications as is told in the context of Saptopakrama in the Ranashofa. The same plan of management can also be done here, sir.
Okay. So if cyst is having fibrous sac,
Yeah.
then there is no possibility of healing without the Kshara Karma or Shalya Karma?
Yes, sir. Definitely. In such cases only, we excise it and we go for Kshara Karma.
Okay.
Because of that, in the initially, in the anatomy also I told, if the tissue remains, it is not allowing the wound to heal, the sinus to heal. So
Correct.
for that reason, we'll go for the excision followed by Kshara Karma, which whatever remnant portion will be there in that wound, which is taken care of Kshara and it does the chemical debridement. So the wound will become the Shuddharana and it starts healing by application of Jatyadi or other Grita.
So Rakta Mokshana is leech application.
Yeah, sir. Rakta Mokshana, I told in the beginning, like inflammatory condition like Ranashofa Avastha, before going for the pilonidal abscess, when the patient comes with a history of pain, fever and discomfort, that time if you find that it is an inflammatory condition, not ripened, better go for the Rakta Mokshana there, Sthaniya Chikitsa.
Okay. Which lepa you want to suggest, sir, for Apakva Avastha?
Yes, sir. Marmani Gudika Lepa and Dashanga Lepa, which we commonly do in our cases, sir, which we practice.
Any Upanaha you want to suggest?
We have not practiced. We used to have these lepas only, sir.
Okay, sir. Sir, you told Agni Karma, after opening the tract, you are doing Agni Karma?
No. For opening the tract, we are going for Agni Karma.
Okay.
Because if it is a superficial one, so
Hmm.
it is not necessary to go for Kshara Sutra or Kshara Karma. Instead of that, better go for taking out, opening that tract, subcutaneous sinus tract. We can go for the Agni Karma. We will open it up and then we'll either by Shalaka or by Panchalava Shalaka or by simple thermal cautery or bipolar cautery. You just let it open. It becomes an open wound and it heals.
Okay. Any other new innovations in this regard?
Sir, how to insert probe in case of single opening during umbilical sinus or any other place other than sacral? Yeah, one question is there, sir. In case of umbilical sinus, you need not go for probing or finding then another opening. It is where you can use the artery, you can take out the foreign body of that hairs and debris, irrigate with the hydrogen peroxide, keep Jatyaditaila Varti or other Vartis what we have mentioned, or even Kshara Sutra Varti also you can keep. And you educate the patient that every time during bath you need to have a cleaning of that particular area. It is not necessary to go for probing there and finding another way, creating another way and application of Kshara Sutra or Kshara Karma, especially in case of umbilicus. Because in case of such chronic conditions, better go for excision of that one. You need to go for like excision of that sinus. It is like a surgery only. You have to go for. It is difficult. One question was there, sir. Any other questions? Screen share. Who can see here? Yes, sir. Yes. Sir, I don't think any messages are left.
Sir, one dot for myself.
Yes, sir. Definitely,
In
Dr. Nitin.
periodic Sir, from
Sir?
in preauricular sinus,
Yeah,
the sinus opening will be not too much opened also, sir, to keep Varti.
yeah.
And opening to, if the sinus is open to EAC,
Hmm.
external auditory canal, can we
Hmm.
do Kshara Sutra there? And which will be the
So,
best procedure there, sir, in
no,
preauricular
once
sinus?
you could able to get very probing possible, then you can go for this Varti also, doctor there. Hmm. Otherwise, go for
Uh-huh.
excision only. Hmm. Because it is a
Sir.
rare condition. We are not getting frequently those cases. Hmm.
Sir.
Yes, sir.
Any more questions? Okay, Dr.
Yes, sir.
Nitin. Sir,
Thank you,
thank you very
sir.
much, Dr. S.A. Patil, sir,
Thank you, Asan sir
for
and
giving
Nitin doctor.
very practical insights on diagnosis and management of pilonidal sinus.
Yes, sir.
We would like to continue this series with the next time the fistula in that is
Yes, sir.
diagnosis
One more
and
question is there, sir. Vasan sir. How
uh,
to identify sinus in early stage?
okay, sir.
So early stage identification, patient has to complain that there is some discomfort or any discharge or anything. Then only you can identify. Otherwise, it is not possible. Sometimes what happens, initially there is an abscess. Once it is burst open spontaneously, it becomes a sinus. That time patient has to tell us, patient has to complain. Otherwise, identification sinus is early stage is difficult unless until they complain. If they are very sensitive and health, very much cautious about the health, definitely they come. And if they come initially, it can be managed accordingly. If it is an abscess or if it is an early sinus, because initially with the small tract with this one, you can definitely go for Vartis that will heal the sinus. Thank you.
Any more questions?
Yeah,
The
one
next
more
session.
question. Do all abscess lead to sinus? Uh, Definitely, if it is at the postnatal area, if that abscess is spontaneously ruptures, definitely it becomes a sinus. If it is not possible, the patient is very sensitive, he will not tolerate, he will definitely come to a surgeon. You need to go for incision and drainage. Definitely, if it is at that particular part, it becomes a sinus, or else if it is a localized condition like a skin lesion formed like an abscess, you need not worry about the sinus. This will not exist as a sinus opening. It will be only abscess. You just drain and irrigate it and ask for the regular dressing. It will be all right. Vasant sir,
Sir.
shall we wind up with Dr. Nitin?
Yes, sir.
Yes.
Yes, sir.
Sir, thank you very much for your insightful
Thank you, sir. Thank you very
presentation and
much for
lecture.
this opportunity. And I thank all the audience. I think I have sensitized and given some information about the pilonidal sinus and other aspect differential diagnosis. Thank you, Dr. Nitin and Dr. Vasant, sir, and all my postgraduate scholars of Ayurveda Mahavidyalaya, because all the way they are collecting information and supporting like Shashank, Ganesh, and other. Thank you, one and all.
Okay, thank you, sir. Thank you very
Okay,
much
sir.
for a very insightful
Thank
talk on the diagnosis and management of pilonidal sinus. In the next series, we will continue with the same insightful and very informative and very invigorating and enlightening lectures, especially practical oriented and experience oriented lecture that is next forthcoming. It will be on diagnosis and management of fistula and ano.
Yes,
Will
sir.
be the Chaturveda Chikitsa of Sushrutas. Okay. Thank you,
Okay,
one
sir.
and all,
Thank you, sir. Thank you.
for participating. Thank you.